Hi, we're here with Lauren, and really we just have one question, which is, what's one thing you want clinicians and or researchers to know about people with lived experience with pain?
Yeah, I think the main thing that I would want them to know is that we bring a wealth of experience to the conversation. We see a very different perspective when we are on the receiving care end than those physicians, because we're the only people that truly carry our journey through the system. And through that, we develop a lot of education and information, and there's some great education on that as well, about the types of knowledge that we carry. And it's really interesting to understand and see that perspective, because sometimes it's a view that's not seen from the insider's role. So I think that the inclusion of the patient voice is so critical in all that we do and can bring so much power to the conversation.
Great, that's an awesome one thing. And I'm just curious, like in that, bringing that expertise, I guess, to the table, do you find that that's something that doesn't happen, or is it hard to do, or is it something that you have to learn how to do? To like, how do you navigate that idea?
No, that's a great question. I really think it's a learning curve for everybody. So for patients to be able to have gone through their journey and to reshare it, it can be really re-traumatizing. So it takes a lot of practice and a lot of education to understand the best practices and ways that you can bring your voice to the table in a professional manner. In my role specifically, we talk a lot between advocate and educator, and you want to be on the educator side where you're able to work together and come and bring shared knowledge to further one goal. And it's the same thing from the provider and the researcher side. If they're not open to hearing the other side, that's a major barrier to patient engagement. So really understanding that everyone at the table has important information, they're there for a reason, and everybody's trying to contribute to the same process.
Yeah, fantastic. That's a great one thing. Thanks for sharing it, and enjoy the rest of the conference.
Thank you so much.